we're going to be talking. So this is what we're going to be talking about today. So calm and clear, a holistic approach to food allergies and intolerances. And I am Lisa, and I am the pediatric naturopath, or I own the business, the pediatric naturopath. So um, this is me on a rare occasion when I have my hair and makeup done, my once every 10 years. But as you might be able to tell, I'm actually Irish. And I did my original degree back in Ireland many, many years ago in mechanical and food engineering. So I've had a little bit of a career change since that. And I did my master's back then in food science. And great to have some lived experience of some gut issues. So I managed to give myself E. coli 0157H7 when I was doing my master's, got very, very sick, and developed some long-term autoimmune issues as a result. So I've spent most of my career working in the food industry. So again, very different to what I do now. So I've worked for Cadbury's, I've worked for Kellogg's, I've worked for Freedom Foods. But really, I just got to a point in my life where I thought, I don't want to use my skills and my knowledge to basically promote a more unhealthy world. I want to use my skills and knowledge to promote a better world. And I think for those of you who have kids, that can also be a real eye-opening experience for you, especially if they've got health issues. So I've had some of my kids have allergies, which we'll talk about today. One has complex congenital heart disease. So, I'm very much invested in kids' health and helping kids to thrive. So this is just a big, big list of all the other extra training I've done in pediatric health. So today, what we're going to be talking about, and we will be talking about it with a pediatric lens, but a lot of the things that we will be talking about also apply to all age groups. It's just that my clientele, my patients are generally kids. So we'll be talking about food reactions and the difference between allergies, intolerance, and sensitivities. We'll be talking about the root cause of some of these issues. Testing, is it worth it? Should we bother? And then some suggestions about how to recover for some of these food sensitivities and some real life success stories. Now, I can see some chatting happening in the chat, so that's great. So hello from the Barossa, very nice. Hello from Adelaide, Queensland, Sydney, Perth, great. So we just need a Queensland person. Oh no, we've got Queensland, great. So we've got most states represented there. That's awesome. So if you have questions as we go along, please pop them into the chat. I've got a lot to get through, and I want to make sure I answer everybody's questions because obviously you've turned up live. I assume that you want to ask me things specifically. So I'll move fairly quickly through the content to make sure we get through everything. But please just pop questions into the chat as we go. And when I get to the end of the section, I'll look at those questions because I think questions are a lot more relevant if you ask them, when we're discussing the topic. If it's something that we're going to be covering later on, then I'll just let you know, or I'll just ignore the question. I will cover it later on. So, understanding food reactions. And you see, I've called it food reactions because it's not just allergies. It's not even just intolerances. This is a handy little chart from the Royal Children's Hospital in Melbourne to kind of give you an idea of some of the things that we're going to be talking about. So the first thing is to have it classified as a food reaction, it has to be reproducible. So we went out for sushi last week. My daughter got food poisoning from the sushi. She had sushi, the rest of us had something else. And she had diarrhea from the sushi. So that was not an adverse foods reaction because that's not reproducible. If we went out for sushi tomorrow, she wouldn't have that reaction. She just got food poisoning. So it has to be something that is going to reliably happen over and over again. And then you've got allergies, which are mediated by the immune system. So we've got the kind of poster child of allergies, and that's the IgE mediated ones. So I always remember this E is for emergency. So this is where somebody eats a food and very, very quickly, within an hour, they will have a reaction. And it might be an allergic reaction or it might be an anaphylaxis reaction. Then if you look over on the right-hand side, there's non-IgE mediated. This is where you do not want to have a little glass of wine and then try and pronounce these things, but I'll go slowly. Food protein-induced allergic proctocolitis, food protein-induced enteropathy, food protein-induced enterocolitis syndrome, and then other enteropathies. And I'll be talking about all of those in detail later. And then you've got the section in the middle, which is a mixture of the two. So a mixed IgE and non-IgE. So we've got atopic dermatitis, which is eczema, and eosinophilic esophagitis, which we can call EOE for short. And then what they haven't included in this chart is a whole other set of reactions that you can have. So you can have an IgG mediated reaction, or you can have reaction to food compounds or food chemicals. And there again, something different. So we'll start with IgE. So this is an immune system reaction that happens immediately or within really 1 hour of food consumption, even a tiny amount. So my middle child used to be allergic to egg. And so she was at preschool or daycare. They made burgers. So in 2 kilos of mince, they put 1 egg. She had 1 bite of 1 burger. And I'll tell you what happened later on. But so she had a microscopic amount of that egg and had a massive reaction. It sounds silly. It sounds like you're a hypochondriac, but that's where your level of caution needs to be. And then you can have all of these things. So the hives, the itching, the sneezing, chest tightness, nausea, confusion, anxiety, like really, really wide range of things. And I've highlighted here low blood pressure because in my daughter's instance, she was 22 months old. In children of that age, a symptom of anaphylaxis can be pale and floppy. And that's because their blood pressure drops so significantly. So she had the bite of the burger, she passed out, and that was anaphylaxis. Luckily, she recovered fine. She did a big spew about half an hour later, and she was fine. But anaphylaxis is life-threatening. So if you know somebody with a anaphylaxis reaction to a food, they need to carry an EpiPen at all times. Actually, they need to carry 2. So Australia is a bit of a hotbed of allergies, and about 20% of the Australian population has an allergic disease. And by 2050, the number of patients affected by allergic disease in Australia will increase to 7.7 million. And Australian children have the highest prevalence in the world. Whoops, what happened there? In the world. In a Melbourne study showed that 40 to 50% of children had some sort of symptoms of allergic disease in their first 4 years of life. And so with IgE food allergies in Australia, 11% of children in Australia have an IgE food allergy at the age of 1. So 1 in 10 children. And that reduces to 4% because a lot of children will grow out of their egg allergies. And some groups, such as first generation of immigrants from Asia, have a much higher rate of allergies. And that's where the research has been done. It's on first generation immigrants of Asian people. But I would say that possibly it's immigrants from anywhere in the world. So obviously being from Ireland, I don't have any allergies. You know, one of my family back home has allergies, but 2 of my kids had severe allergies. So something there. And these are the top IgE allergies in Australia. So milk, eggs, peanuts, tree nuts, sesame, soy, fish, shellfish, and wheat. So those are the ones that will generally be labeled on foods. And this chart is really interesting because it shows when these different allergies will pop up. So with my middle child, the one that passed out with the egg, she actually had skin prick testing when she was 6 months because when I started solids at 5.5 months, she had a reaction to egg. And because of her heart disease, I got very much escalated up the triage. So she saw an immunologist for skin prick testing at 6 months. And at that point in time, she had an egg allergy and she also had a milk allergy, which I didn't know. And you can see in this chart, those are the two that crop up first. But then you see egg drops right off. So by the age of 20, not many people are allergic to egg. Not many people are allergic to dairy. But then other ones come in a bit later. So wheat, peanuts, tree nuts, and then shellfish is one that can develop as an adult. You can eat shellfish your whole life, and then when you're 40, you have an anaphylactic reaction to a prawn. So then we've got our non-IgE allergies. These are the ones that are difficult to pronounce. So we'll start with food protein-induced allergic proctocolitis. So this is a slow onset. There's intermittent blood and mucus in the stools, but the child is otherwise healthy. They might have reflux, feeding difficulties, irritability, poor sleep. And it tends to crop up when the child's about 1 to 4 weeks of age, but anytime up to 6 months. And it will improve with age and it will resolve by late infancy. So you might need to cut out trigger foods, but you'll be able to bring them back reasonably quickly. It's common in breastfed babies, but it also can occur in formula fed, and it's often milk, soy, and then sometimes egg, wheat, and corn. Then we've got food protein-induced enteropathy. So this is where the symptoms happen about 1 to 3 days post-trigger foods. But of course, a 2-month-old baby is only having one food, like in this case, say formula. So the symptoms are constant because they're only eating the one food. And they might have diarrhea, vomiting, failure to thrive, and occasionally bloody stools. So it will happen between 2 months and 2 years. And again, top foods, sort of cow's milk, soy, but also wheat and egg. And then FPICE. FPICE is quite different. So FPICE basically causes severe vomiting. So it's not just you eat something, you have a bit of a spew. It's where you eat something and then you spew and you spew and you spew and you spew. And it's kind of, you're at the hospital level of vomiting. And again, milk, soy, and then some different things, oats, rice, poultry, fish, fruits and vegetables. So I've met kids who have FPICE to like avocado and coconut. And it usually comes up at solids introduction because that's when all of those foods will get introduced. So switching gears slightly to celiac disease, because of course that's also a food reaction. And this can start in little kids, so in the first 2 years of life, or it can happen much later in life. And the problem is that it's very often underdiagnosed or undiagnosed. So your 10-year-old might get diagnosed with celiac disease, but actually they might have had it since they were 2. And that's because the symptoms are so variable and there's a lack of awareness about the variability in the symptoms. So chronic diarrhea is kind of an obvious sign, but that's only in 50% of people. Abdominal pain, nausea, vomiting, reflux, bloating, constipation, they're all the gut symptoms. So, in most cases, if you go to your GP with some of these gut symptoms, they will consider celiac disease. But the problem is that all of these symptoms are also issues associated with celiac disease. And these are seen in up to 60% of pediatric celiac patients. So short stature, so being smaller than you would anticipate, is a sign. Weight loss, failure to thrive, chronically low iron, issues with your teeth. I see this a lot. So having those bad teeth when your teeth should be fine. So you're not eating a lot of sugar and soft drinks, but for some reason your teeth are really bad. Mouth ulcers, headaches, elevated liver enzymes, epilepsy, huge crossover with celiac disease, joint pain. There is a skin issue. You don't see that much in kids. You see it more in adults. Anxiety, depression, delayed puberty, or missing periods. And some GPs are awesome because you bring your child in with them and you say, oh, my child's got really bad anxiety. And the GP might ask a couple of other questions, say, yeah, they've got 4 fillings and, oh, they've always been iron deficient. And the GP might consider testing for celiac disease. But in a lot of cases, you will go and you say, oh, my child has anxiety, and they'll write a script for anti-anxiety medication and not ask all these other questions. So really important to be aware of that. So then we'll move on to the mixed ones. So the eosinophilic esophagitis. This is a new sort of diagnosis, maybe just because it's been better diagnosed, or maybe it's just increasing the way all allergic things are increasing. But this is something that I see a lot with kids who are fussy eaters, because the symptoms include food refusal, slow eating, abdominal pain, vomiting. So if your little person has got constant pain in their esophagus, of course they're not going to want to sit down and eat, steak and salad for dinner. Because they're having all of these issues, but they just can't articulate it or verbalize it. School-age children and adolescents might have reflux, difficulty swallowing, food impaction, where the food actually gets stuck, or choking. It goes alongside with a lot of other things like allergic disease, celiac disease, Ehlers-Danlos, and it can be to all kind of the usual suspects. The only way to diagnose it is with an endoscopy and biopsy. So it's obviously, I can't diagnose that as a naturopath or a nutritionist. I need to send children off to gastroenterologists. And then atopic dermatitis, so eczema. This is a bit of a busy slide, but basically there's a big overlap with both IgE and non-IgE food reactions with atopic dermatitis. So many children with eczema will improve significantly if we can just identify what their trigger foods and remove them. But that definitely has to be done in a very prudent manner, because if you just go off on a wild goose chase of avoiding the soy, the milk, the wheat, the eggs, yada, 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 your child will end up on a very restricted diet, which will lead to gut issues. So now I move on to IgG reactions. So IgG reactions are a bit more controversial, for want of a better word, and they're not very well accepted in the general medical fraternity. And they're much more hard to identify because they're a slow burn. So this is where you eat a food on a Monday and on a Wednesday, you've got a migraine. So who remembers what they ate 48 hours ago? It's really hard to correlate your symptoms on a Wednesday with what you ate on a Monday. And also the IgG reactions tend to be really common foods, again, like wheat, eggs, dairy, things that you're eating all the time. So you might have asthma every day, and that's because you're eating those foods every day. May affect 5 to 20% of the population. And the issue here is more to do with increased gut permeability. And so I will often do an IgG test with people in clinic, and it's never failed me. So I always get very useful information from that. But at the end of the day, with all of these things, the gold standard remains elimination and reintroduction. Not that we would ever reintroduce gluten for a celiac or an IgE food without medical supervision, but that's really the best way to assess these things. So some people will react to gluten. They don't have a wheat allergy, and they don't have celiac disease, but they have something called non-celiac gluten sensitivity. And it gives similar symptoms. There's no test for it. And then it gets a bit messy with, FODMAPs and gluten, and, foods are not single component entities. So it's very hard to pull it apart. But you can see that some of the symptoms of non-celiac gluten sensitivity are autoimmune disorders, gut issues, neurological disorders. There's lots of overlap. Lactose intolerance is where you have a problem with lactose. So it's not the protein in the milk, it's not the fat in the milk, it's the lactose in the milk. And it's usually more a dose issue than having a flat out intolerance to lactose. Infants and younger children will have like green frothy explosive poos. Older children might have abdominal pain, bloating, nausea, gas, and diarrhea. It's very rare that young people have an actual lactose intolerance. It's more a fact that as you grow up, you lose the ability to digest lactose. Because obviously, if infants had an actual lactase deficiency, then that's a life-threatening issue. Invariably, when I say to somebody that they need to cut out cow's milk because I think their child has an allergy to cow's milk, like an IgG allergy, for instance, they will go off and they'll buy lactose-free milk. But that's not going to help. So there's a big, big difference between lactose intolerance and cow's milk allergy. And for cow's milk allergy, you need to avoid anything dairy. Lactose intolerance, you just have to avoid lactose. So maybe move to lactose-free milk. You can maybe have hard cheese. You can maybe have 24-hour fermented yogurt. Um, so you can see that the lactose intolerance will cause like the diarrhea, the nausea, the flatulence. This I love this word, borigamy. I don't even know how to pronounce it, but basically when your gut is really noisy. Um, but lactose intolerance won't cause blood. It won't cause eczema. It won't cause asthma. So now I am racing through this because I'm just conscious how much I have to get through. But does anybody have any questions on anything we've talked about so far? So celiac disease, IgE allergies, IgG, non-celiac gluten sensitivity. Any questions on anything so far? I'll just give you a minute to pop them into the chat. We got someone from Melbourne, so that's good. Hello, Brooke. Nope, that's all right. I'll keep going, but feel free to pop anything in if you have a think. So these are the food chemicals. These are not discussed that much. So a lot of this may be quite new to you. So we've got salicylates, amines, glutamate, and oxalates. And these are all types of phenolic foods. So salicylates, you just think the really bright colors. So the berries, the tomatoes, the watermelon, herbs and spices, basically all the really, really wonderful food. So if a child comes to me with eczema and I look at their food diary and I go, oh my God, you've got like the perfect child. They eat so many fruits and vegetables. Sometimes they've got a salicylate issue and they're actually just eating too many salicylates. I pretty much never put people on a low salicylate diet because it is so dull and so boring, but we can just manipulate the child's biochemistry to make sure that they can tolerate salicylates better. Then we've got the amines, so fermented foods, aged meats, even bananas, cheese. I've got glutamates. So again, cheese, Vegemite, MSG. So this is why I don't usually put people on a low salicylate diet because this is the standard diet. You've got your orange, you've got your berries, you've got your coffee, probably not for a child, but you know what I mean. And then it's your personalized low salicylate diet. So you've got an apple, a golden delicious apple, not a red one, and a pear, and then you've got more pear, and you've got a glass of water. So if you try to do this diet, you will find yourself eating a lot of pears. It's pretty much the foundation of the diet. So it's the clues, other than just having a generally great diet high in fruits and vegetables, the other clues that somebody might have a problem with salicylates are hyperactivity, red cheeks and ears. So that's a classic. If a child eats tomatoes and gets bright red ears and runs around circles in their backyard for the next half an hour, it's a salicylate problem. Defiant behavior, that's pretty much childhood, irritability and aggression. Continence issues, congestion, abdominal pain, diarrhea, hives. So you just have to ask lots of questions and then think, what could it be? You can't really test for this. The only test is to do a low salicylate diet for a couple of days and see what happens. So histamine intolerance is where your bucket in your body of histamine just gets full up. And then every time you eat histamine, you get a reaction. So the reaction could be hives, could be anxiety, can be lots and lots of different things. And it can be because you don't make enough of the DAO enzyme in your body. But it can also be because your bucket is just too full. You've just eaten too many high histamine foods. It can be because you've got bacteria in your gut that are producing histamine. And it can just be a genetic thing as well. So these are some of the symptoms. So flushing, but then you need to think about other things: itching, rhinitis, hypertension, vertigo. Symptoms of glutamate issues. This little child in the picture says it all. So hyperactivity, headaches, imbalanced hunger regulation, asthma, anxiety, and gut issues. So if you think of pizza, pizza's like takeaway pizza, which probably has some MSG. It's got the cheese. It's got probably some mushrooms and some cured meats. If your child has that and then goes wild, it's probably a glutamate issue. And then oxalates. Oxalates, again, it's your child or your person will have a great diet and they're having all of these symptoms: headaches, anxiety, brain fog, moodiness. Some of the sort of classic ones for this: burning feet and sandy stools, cloudy urine, and vulvodynia. So if somebody has those symptoms, plus if they've been living in a moldy house, then it might well be an oxalate issue. And again, I hate to put somebody on this diet without good cause, because what you're doing is you have to cut out nuts, beans, beetroot, like all these wonderful foods are high in oxalate. So I made a massive mistake when I started to practice many years ago, because somebody came to me with all of these symptoms. I took them off all of these foods. 2 years later, and her issues just went away. So obviously she didn't come back to see me because she wasn't having any issues. I met her a few years later and she was still eating a low oxalate diet. So she was eating a lot of white bread and very plain basic foods because that was keeping away her symptoms. But that's never the end game. You never want to stay on a restricted diet permanently. I've met people who have been on a low salicylate diet for 20 years and their gut is just an absolute mess because they've restricted so many foods for so long. So what we need to do is always get to the root cause. Don't just go on a strict diet forever. So the big question is why are all these issues increasing? Why are allergies increasing? And there's a few different reasons, which we'll talk about. So there's the hygiene hypotheses. Studies show that people with dishwashers have higher rates of allergies in their family. I don't know, but even after having 2 kids with allergies, I'm not sure that I could say goodbye to my dishwasher. Having low vitamin D, obviously the safe sun message has been very strong for the last 40 years. So now we have a different problem. We've got low vitamin D, antibiotic exposure, gut dysbiosis, delayed introduction of allergenic foods. And I mean, the recommendations on this have flip-flopped and flip-flopped repeatedly over the last 40 years. And a lot of people still have the little thing in their head, food before one is just for fun. But food before one is to increase your tolerance to it. So never delay introducing foods because you're worried about allergies. It's actually the opposite. If you're worried about allergies, get those foods in as soon as possible. Having said that, when I gave my daughter eggs at 5 months and 2 weeks, she was already allergic. So I couldn't have actually really brought it in any quicker than that. So she already had the allergy. But because she has congenital heart disease, she had truckloads of antibiotics for the first 3 weeks of her life. And she no doubt had really bad gut dysbiosis. So there's lots of different things to look at. So the dual barrier hypothesis, we will talk about that in a minute because that might be a new term for some of you.
Yeah.
So these are some of the risk factors. So family history, you can't outrun your family, unfortunately. If you do have a history of this in your family, then your child will too. Pregnancy, maternal obesity, smoking, and again, highly restricted diets can lead to food allergies. Birth and early life factors. So I've mentioned my daughter had truckloads of antibiotics plus many, many, many other drugs. So that was unavoidable. That saved her life, but no doubt contributed to her allergies. C-section birth, formula feeding, all of these things. And your environment, so where you're actually where your microbiome is from, because you get your microbiome from your parents, and then where your microbiome is living can all impact. So the hygiene hypothesis is basically saying that a lack of childhood exposure to microbes will lead to an understimulated immune system, which makes you more prone to allergies. So children's immune system need microbial input from soil, from animals, from siblings. So having pets is helpful, having big families is helpful, living on farms is helpful. And then your gut microbiome is affected by this as well. So, getting your kids into the garden, bush schools, all of those things are so important. So thinking about your child's first 1,000 days of life, this is when you really want to be working on your child's immune system. So I met someone the other day, I think their child was 5 and they had food allergies, and she said, we should get a dog. I was like, yeah, you're probably too late. They're probably allergic to the dog by now. But if you had have got the dog when your child was born, then it would have been helpful, but it's not going to help now. Looking at things like antibiotics, definitely minimize reflux medication, so harmful for your gut health, ultra processed foods, so foods that are, extruded, like really heavily processed in factories, exposure to pollution or chemicals like bleach. All of these alter the immune system in the wrong direction and increase the risk of food allergies. Children with food allergies will have lower diversity, so less different bacteria in their gut, less of the anti-inflammatory bacteria, and more of the inflammatory bacteria. And I'll show you some examples later on of testing to reflect that. So the dual allergen hypothesis. This, when I heard about this a few years ago, it actually blew my mind. So what this is basically saying is that exposure through your skin, so if your skin barrier is broken or inflamed, like an eczema, may lead to sensitization. Exposure through your mouth will help your immune system and reduce the risk of allergy. So this is where eczema is a bit of a two-way street. Food allergies are very associated with eczema, but is it because the child with eczema has broken skin, so they're getting exposed to the foods through their skin before through their mouth? Would they, if their skin barrier had have been maintained, maybe they wouldn't have been allergic. So it's very interesting. And kids with eczema have a weaker skin barrier overall. So even when their skin barrier is not broken, they will still, have a weaker skin barrier, which makes their eczema or makes their allergies worse. So yes, don't delay. Early introduction of allergenic foods is the most promising strategy to prevent food allergy. So yeah, I mean, it's just such a moving feast, but work towards getting as many allergens into your diet before they turn 1. Fish oil. What is fish oil not good for? So for pregnant ladies, taking omega-3 supplements during pregnancy can lower the chance of your baby having food allergies or eczema. It's reducing inflammation, it's supporting the gut microbiome, and just, it helps with everything. So that's a no-brainer thing to do if you're pregnant. Vitamin D, good during pregnancy, but also good for your child. So kids with low vitamin D levels are 68% more likely to have a food allergy reaction. And babies born in winter or living in areas with less sun are at greater risk. So I do like to test vitamin D to actually quantify how low it is. So if your child or yourself are having lots of allergies, environmental allergies or food reactions, just get your vitamin D checked. Very easy. Your GP will do it for you every few years. And you want it to be around 100. So you don't want it to be like 50, like it might say. You want it to be around 100. Stress. You can't underestimate the impact of stress on everything. So stress can impact food reactivity. So even with kids, just making sure that they're not living a stressed life. And the problem is if you've got something like eczema and you're itching all night long, you are stressed. So you need to find a way to break the vicious cycle to reduce stress for your child. Or in adults, you can be a little bit more proactive about how you manage your stress, meditation, walking, getting enough sleep, whatever works for you. I just love this paper because this is just a problem that we see so much about people really restricting their food. So it's looking at the factors between maternal anxiety and development of food allergy in kids. So postpartum maternal anxiety mediated by reduced diet diversity. So basically people who are cutting out a lot of foods and subsisting on lamb and sweet potato. That's actually a risk factor for the development of food allergies. So really, you just need to seek professional help to make sure that you're not just cutting out foods that don't need to be removed. Testing. When it comes to IgE, there's a couple of options. So you can go to an immunologist and do a skin prick test, or your GP can just do a blood test and measure your IgE. And Medicare will let you do about 5 of these every year. And you can do foods, you can do environmental allergens. Skin prick testing, it says here that it's, I think it says somewhere that it's cheap, but it's absolutely not cheap. Or maybe I made that up. So this is where they actually prick your skin and then measure the wheel and you get the result straight away, but you can have false positives because at the end of the day, it's what happens when you eat the food, not what happens when you rub it into a little pinprick in your skin. IgE, it's a blood sample. It can also give false positives more expensive. So this is what I'm not sure. It's not really more expensive because your GP can do it under Medicare, whereas this one you have to see an immunologist. That's always more expensive. But both are useful, and I do both. I've done both for my kids. IgG allergy testing is a blood test, and your GP won't order that. Your immunologist won't order that, but your naturopath or your nutritionist can. And it's usually a blood draw, but sometimes it's a finger prick one as well. And it gets sent off and tells you what the IgG reactions are. And if somebody has a lot of reactions, it usually just means they've got a leaky gut. And then we've got something called food-specific IgG4, which is something kind of newer that I haven't really experimented with as much. But a good example is when kids do oral immunotherapy, where they're given little bits amount of the allergen to build tolerance, their immune system will actually start to produce more IgG4 and less IgE, which is good because you're actually trying to stop the IgE reaction. But then you're creating this other thing. So some new research suggests that kids with eczema, high levels of IgG4 may be linked to flare-ups. So you're avoiding anaphylaxis, but are you actually causing different issues? So we can measure IgG4 as well. And then we do a lot of stool testing. So stool testing will look at the environment. It will look at, your microbial groups like bifidobacteria. It will look at the hexa-LPS, so the lipopolysaccharides. It will look at the histamine-producing bacteria. But what parents are often disappointed about is that it won't tell you what your child is reacting to. It will look at if they're reacting to something, and then you just need to work out what it is. So it gives you half the story, but it doesn't tell you like you need to cut out eggs. So what do? We do all of these things. So we look at the intestinal permeability, we look at inflammation, we look at digestive capacity, immune function, microbiome, and of course, we avoid the allergens. So, and a lot of many of the infant issues are just, you just cut out the foods. You don't really have to do anything else. You just cut out the foods that they're reacting to. So with the proctocolitis and the enterocolitis, you eliminate the food triggers and then you reintroduce around 12 months. So it's not a lifelong thing. You need to be very mindful that you bring these foods in as soon as you can without reactions to avoid the development of an IgE reaction. FPICE, same thing. You definitely need to remove the foods unless you want to get covered in vomit frequently. But again, by the age of about 2 or 3, your child might be better. So you need to work with somebody like an allergist or an immunologist to make sure that you're strategically bringing these foods back in. Low phenol diet, so that's the things like salicylates. I'll just move to this one. These are a couple of the diets that are helpful to look at. So the Royal Prince Alfred, the Feingold, and the Failsafe. So they're all a little bit different. Their lists of what to remove are a little bit different. And what these diets don't do is they don't talk about how to get to the root cause so you can bring these foods back in. So some simple things that everyone can do at home: Epsom salt baths. So that's magnesium sulfate. That's going to improve the sulfation pathway. Addressing methylation, which is a whole other 60-minute lecture, and giving digestive enzymes or liver support may be helpful. But yet, hopefully you're getting the message that don't just cut out these foods and walk away. You know, before Ritalin was a thing, diet was used in hyperkinetic children, so children with ADHD, and diet was really, really successful. But of course, diet's very difficult. But if you do have a child with some ADHD-like symptoms, you might want to look at their diet first and foremost and see what you can change. So how to work on that gut to improve the situation? Prebiotics, things like onions, garlic, bananas, oats. So if you've ever been on a low FODMAP diet, you've probably cut out a lot of these foods, which again, you never want to stay on a low FODMAP diet for a long time because you're reducing the very foods that improve gut health. Polyphenols, basically just a fancy name for the color that's in fruits and vegetables. Resistant starches. I'm Irish, so I love potatoes generally, but if you cook potatoes and then have them cold or room temperature the next day, that's a really good source of resistant starch. So really good for feeding up your gut bacteria. Fish oil to reduce inflammation. And things like glutamine, vitamin D, vitamin A, zinc, carnosine will all improve the gut lining and make you less IgG reactive. Food ladders, I'm just going to skip through this because this is all readily available online. But if your child has an egg allergy or a soy allergy or a milk allergy, you may start on a food ladder. So that's basically just introducing teeny tiny bits of the food in a very easy to tolerate form and then building up very, very, very slowly, which might take years. So I'm just going to talk about some success stories. So, great question. Thank you, Brooke. So fish oil, cod liver oil is even better because if you think about the things that I recommended, I said fish oil, vitamin A, vitamin D. Proper cod liver oil is fish oil, vitamin A, vitamin D. And when I say proper cod liver oil, some cod liver oils are just fish oil that have been fortified with synthetic vitamin A and vitamin D. That's not really what you want. You want the cod liver oils that are naturally containing high. So yes, the Rosita brand. I mean, I'm not sure if I'm allowed to mention brands, but yes, that's the good brand. So my son was allergic to all of these. So all the tree nuts, which is easy enough because that's always listed on the packets. But then little cherub was also allergic to green peas, chickpeas, lentils, sesame dust mites. It was a right laugh. And now we've reduced it to pecan, walnut, cashews, pistachios, and dust mites. Funnily enough, my daughter was allergic to egg and dairy, and he never had a problem with egg and dairy. So go figure. So this is an example of what used to happen to him. And I've put this lovely little photo of him to show you this is what his actual face looked like. And this, despite being a food scientist, nutritionist, naturopath, I have given him foods he's allergic to many times and therefore have these wonderful photos of when I've done that. So you can see the poor little eyes all swollen up, the nose streaming, generally very miserable. And the swelling of the eyes takes about 48 hours to go. So this was his stool test that I did quite a few years ago now. And you can see these are, the good bacteria. And you can see he was low. So despite having a great diet, he had antibiotics. He has had antibiotics in his life, maybe like 2 courses ever, and he's 10, so not a lot. But he was low in good, like beneficial bacteria. And he had very high levels of this bacteria, Citrobacter, because you can see the normal level, if you remember your high school maths, exponential 6. So 6 zeros, he was at exponential 9. So he was 1,000 times over the limit. So what did we do? Give him prebiotics, so both in food and supplement form, and gave him a herbal blend to reduce the Citrobacter. And this is other allergy kids that I've seen as well. And you can see Citrobacter, this one had 100 times more of the Citrobacter frundi, and this one had 100 times more of the bigger family of Citrobacter. So definitely a theme, which I did find in the research as well. So you would never know if your child has high levels of Citrobacter without doing a test. So that's why, even though this test didn't tell me what he was allergic to, it helped identify the root cause. This was another child that came to see me. She was 7. She'd had a lot of glue ear, a lot of tonsillitis, ear infections, big adenoids. They were removed and they grew back, which is always a sign that there's an underlying food allergy. She was incontinent and she was a bad sleeper. So she had it all going on. And her vitamin D was 32, which is pitifully low if you want 100 to be where it's at. And her eosinophils were high. And when you've got high eosinophils, it means either you've got a parasite or you've got a food allergy. And her IgE was 114. Usually labs will say anything over 55 is high. I'm not sure why this lab said 400, but it's not super high, but it's a little bit elevated. So we did the IgG test, and I have never seen so much red in a test. And the cutoff for red is, I think, 20. And you can see with things like dairy, she was 100, 145. Spelt, funnily enough, was 160. She had the eggs. She had it all going on. So you look at this, and yes, we need to cut out those foods, but more importantly, we need to do gut repair so that she can tolerate those foods. This is another test that we can look at to look at things like fructose intolerance. So this was a child with celiac disease, had removed gluten, but was still having issues, still having like a lot of the celiac symptoms. And we did this and we found out that she had fructose intolerance, which is quite common for people with celiac. I've got, I think, a couple more case studies and then we'll just have a chat. So this is a great classic sort of one from my practice because I see a lot of fussy eaters. This little guy, he was 3 and he'd been diagnosed with pediatric feeding disorder. So basically a diagnosis of fussy eating without doing any root cause investigation. He had pica, which means you eat non-food items. So he was eating hair, books, paper. He had loose poos, wouldn't eat, had the chicken skin on his arms. He had a stutter. Sent him off for blood tests. His ferritin was less than 3, which is abysmal. And he had celiac disease. So we got him on a gluten-free diet, on an iron supplement. Straight away, the skin improved, the stutter went, and the stools got firmer. Of course, when someone has a like embedded eating issue, there's a lot of work that you need to do to address that with feeding therapy, etc., which we also do in our clinic. But at least this way, we knew why he was such a fussy eater. It's because he was not comfortable. He had a lot of issues. That's just his blood tests. This, again, just a wonderful example. This little child kept poking his eyes, like sticking his finger in his eyes. So they thought he had either had Sjogren's, because that gives you very dry eyes, or something called cerebral visual impairment. But we did an oats test, or an organic acid test. He actually just had a salicylate problem. We cut out the salicylates and the eye poking stopped. And that's just my references. So that was really a whistle-stop tour of all the things. I mean, I didn't even touch on things like FODMAPs, because that's really a gut problem, not a food reaction. So there's so much to it, so many different angles. Foods are not single entities. So trying to work out where the problem is very, very difficult. And that's why it's really good to work with somebody like a nutritionist, a naturopath. We also have a dietitian on our team. So working with someone like that can make sure that you eliminate the least number of foods and you look at why the food reaction is happening in the first place. So hit me with some questions. Tell me what you still are unsure of or what you were hoping to get out of today, and maybe you've still got some gaps in your knowledge that you would like to fill. You can unmute and talk as well if you like. I think that's okay. Don't be shy. No question is a silly question. That's why you've given up your lunch break to be here. There's a lot of people online, so
Hi,
yeah,
I
hello.
might start. Thank you. My daughter's 6 now. I'm the one that posted about so I looked it up. They classified it as the non-IgE mediated delayed gastrointestinal allergy. And they said she was meant to grow out of it at 5 years old. She's definitely not as severe now, but she does have some slight reactions.
Yeah.
More from behaviorally in talking about her tummy being sore. So it's definitely not as bad as when she was a baby. But I don't know whether then that would then turn from an allergy to then being just an intolerance.
And what food does she have that sort of reaction
It
to?
was dairy and egg. So initially she had, as a baby, she'd have a lot of silent reflux. I had to sit her up for 20 minutes after breastfeeding and yeah, and then I stopped everything and there wasn't any issues with the reflux. She used to have blood in her nappies as well.
Yeah. And so they've said it's not an IgE, so she's negative on like a skin prick test.
They didn't do a prick test, but they said that the symptoms, it's often 2 hours later it was
Yeah.
happening. But they did do the blood test at
Yeah.
5.
And does she still eat those foods then? Or what you're saying is when you
Well,
try to
they
introduce.
said that the type of allergy she has, she should have grown out of it at 5.
Mm,
Then they also said my husband's got issues with it, so as well, so it might be genetic and maybe she'll always have issues. So we did trial it. So she's definitely a lot better, but occasionally, yeah, she'll have yeah, and actually she mentioned since we've started dairy again, like here and there, not a lot, but here and there, she says she's always got a sore tummy. So
mm,
even if she doesn't have dairy now. So I don't know whether it's just now because the dairy has damaged her gut a little bit more. So even just as a baseline, her tummy
yeah.
has been affected because, yeah, I think probably if I asked her every day, is your tummy sore? I would say at least every second day, at least she'd say yes.
Yeah. So I think the
Whereas
first,
she never complained about a sore tummy under 5 because we only had about you know, maybe one or two instances. Uh, um, we only had, by mistake given it to her maybe once or twice a year, and then she'd complain about it, but she never had a sore tummy apart from that.
So, I mean, whilst I'm not in favor of heavily restricted diets for long term, I think quite often children are kind of forced to reintroduce foods that they are reacting to. And I've seen that even when kids have positive skin prick tests, they've still been put on like low amounts of the food to try and build tolerance. I completely understand that logic, but also there's no point in subjecting a child to long-term discomfort
Mm.
to decrease their chances of having an allergy. And with my own children, I never gave them small amounts of their allergenic foods because we've had such like I have by accident, but I've never, especially with my daughter, she never had eggs, she never had dairy. And then when she had when she eventually had them, she'd outgrown them. So we didn't need to microdose her with those foods for her to outgrow her allergies. We did do all the other stuff, prebiotics, probiotics, herbs, etc. Um, so I'd say first of all, just cut out those foods and just park it. It doesn't matter if she should have grown out of them by 5. She clearly hasn't. So just take them out again for now. Make sure she's not constipated. And
Yeah.
the best way to do this is actually to do something called the sweet corn transit test time. So give her sweet corn, write down the day, write down the time, give her a decent amount, like a little tinful, and then watch to see when that poo comes out again, when you can see the sweet corn come out in the poo. If it's about 24 hours later, you're good. If it's more than 36 hours later, she has a backlog of poo and she is constipated, and that's why she's having the frequent stomach pain. So just because your child might be pooing every day, they can still be constipated because the poo that they're doing on a Wednesday could be the food that they ate on the Saturday. So do the sweet corn test, cut out the foods, and I would say if you have the budget to do a microbiome test, it's always a good idea because it looks at calprotectin, so the inflammation in her gut. It measures zonulin, which can give you an idea on leaky gut. It measures secretory IgA, which tells you if she's got a food-related inflammation in her gut. And then it looks at all the breakdown of the different bacteria in her gut. So it's kind of just, it's expensive, but it gets you to an answer really, really quickly.
And that's better than doing more blood tests.
Yeah, yeah, for sure.
Yeah, thank you.
No problem. Great question.
Mm.
Anyone else? We've got 2 minutes left. So who has a question that has an answer that will be less than 2 minutes?
Hi, with your testing that you're doing, obviously I know you try and look at like a bit of a diet diary, get an idea of what's going on, anything first. But when you're going through a testing phase to try and source, I guess, the issue if the diet side's not really working for you or whatever, what age group are you, like minimum age group are you looking at that?
Great question. So with something like an IgG test, you have to be 2. If you're younger than 2, it's not accurate. I mean, you can do the test, but it's not going to be accurate, so I wouldn't bother. Microbiome test, we will do from about 1. And we are confident to do microbiome tests in that age because we do so many that we have a really good database of what's normal and what's normal built up. But we would rarely do it at 1 because usually we've got like quite a few things we would need to try first. And that takes, months and months, but we definitely can. Does that answer your question?
Yes, thank you.
And then one more question, which stool test is most beneficial, as in most useful answer? So I have strong opinions on this. Annie, can I mention specific brands here and companies for testing? Yes, I can. So the best one to do is the company is called Microba, and it's a cobiome test because that is the latest and the greatest technologies. And that's I'm very confident in the results that we get from that company. Okay, well, we're at 1 o'clock. So thank you so much for everybody who has joined me live for us today. It's been great to have some questions, and it's been great to have plenty of people that I'm talking to instead of, just talking to a blank screen. So if you want to follow me, I'm on Instagram, the Pediatric Naturopath. I'm on Facebook, the Pediatric Naturopath, and I have a podcast called Holistic Health for Happy Kids. So if you want to follow me in any of those places, that would be wonderful. Thank you.
Thank you. Great talk. Appreciate.